Hello everyone, this is Dr. Mohit and today we'll be discussing about Erythema Nodosum. Okay, so before starting this topic, so I just want to give you an orientation so that where this specific disease belongs. So a question to you straight up, where do you think the problem is? Simple as that. Where is the problem? Is it in the epidermis, or is it in the dermis, or is it in the hypodermis? Yes, so the problem is in the hypodermis. Yes, in the adipose tissue there's problem, there's inflammation right there. To understand that properly and get a better orientation at this topic, we need to understand the classification first. Okay, so I'll just give you a quick run through and a bit of revision with this one topic that we discussed in the introduction of dermatology. Okay, so we're talking about hypodermis, and there is inflammation in the adipose tissue. Yes, it's also called as panniculus, and if there is inflammation of this specific thing, right, the adipose tissue, also called as panniculus, what is going to happen? We will call it as panniculitis. Simple, yes, panniculitis, we would be calling it as simple as that, right? What do you think the function of adipose tissues is? Yes, so it's all about the adipose tissues, right? But the function is insulation and thermal protection. Yes, thermal regulation, right? Okay, these are the two functions of this. Yes, definitely to provide insulation and the thermal regulation is there. If we just focus on this one diagram, yes, a lot of things will be very clear to us. But before that, we need to know this. What are the contents of this? Okay, first of all, we have the fibrous septa and the fat lobules. Okay, the fat lobules are the ones which are the yellow bodies which we see inside this diagram. Yes, these are the fat lobules, and the gray area which you see, these are the fibrous septa. Okay, now we know this much, right? We know the individual things which are happening in the hypodermis. So now, if there is inflammation, if there is panniculitis, yes, if there is panniculitis of the septal area, so what's going to happen is the topic we are reading, that is Erythema Nodosum. I hope that introduction was perfect, and let us just go on, we write up with this. Okay, so this is Erythema Nodosum. And if the inflammation is lobar, right, if you see, if the lobes are inflamed, yes, we would call it erythema induratum. Okay, so if we just out of nowhere, we just one fine day we wake up and we read all this erythema nodosum and a lot of different things, so what's happened is we get confused. But if we know this, just this, the concepts would be very crystal clear, right? It would be very crystal clear. Yes, so alright, so now let us just begin talking specifically about this condition. Okay, that is erythema nodosum. Okay, what is happening? The definition goes by inflammation of the subcutaneous fat. That, yes, what is happening? That these are the erythematous nodules. Yes, yes, these are the erythematous nodules. Yes, and where do you usually see? I think 99% of the images which are floating on the internet, yes, they are, because the presentation is so common, with the specific region, everything, all the documented cases are, they just exclusively, they just find it here. Okay, where is that area? That is on the shin area, right? Usually in the pretibial area. Alright, pretibial region we find this. Okay, why do we have this? Is one most common etiology for this is it is a delayed hypersensitivity reaction. If it is delayed, what type is it? Type 4, right? Okay, to various, it could be some infections, it could be some drugs or some diseases, but most common association is with streptococcal pharyngitis. Okay, this is one important point that we should remember, right? We have to remember this. Okay, most common association is with streptococcal pharyngitis. Okay, all right. That is one thing we cannot afford to forget. Okay, how would be the presentation? Yes, you see, there would be painful erythematous nodules. Yes, in the anterior tibia, there would be malaise, fever, and polyarthalgia. Okay, so let us just see these images in the first place. Yes, definitely this person was not hit by a hot silencer. Yes, and not touched by that. It is not that. These are the erythematous nodules. Yes, we see over here. We can clearly appreciate these, right? These diffuse looking. Yes, which are there. All right. This is the inflammation of what area? These are the hypodermis. Yes, hypodermis. The septa is the one which is getting inflamed. Is it the septa or is it the lobules? It is the septa. I hope we just read about the classification and things should be very crystal clear from now. Our brain should know exactly what the problem is. So if we know that, we can definitely treat the person better, right? 100%. The diagnosis is clinical, yes, but we can perform the biopsy and we would definitely find some fatty inflammation which is there. Okay, that per se is the etiology of it. Okay, and if the person is having, and one of the possible causes was that it has streptococcal pharyngitis infection. So if we find antibodies against this, we could come to diagnosis pretty easily, right? So anti-streptolysin O antibody positive for the cases associated with streptococcal infection. Okay, as simple. Increase ESR anytime in our body. If there is some inflammation, this ESR will be increased. Erythrocyte sedimentation rate would be increased. Okay, all right. So how would we go about the treatment? It is an auto-resolving condition, yes, because the body would take care of that. Okay, but still we could, first of all, we should just try to manage the patient's symptoms. Yes, secondly, infection should be managed properly. If it is pharyngitis infection, yes, we would give antibiotics and we would get that in control. If that is controlled, the symptoms would automatically subside. Yes, we would give NSAIDs, potassium iodide, and corticosteroids just to resolve the aggressive acute presentation. So that was all about erythema nodosum, a very short and crisp topic. If you know, you know. If you don't know, you don't know. Right? As simple as that. Okay. Thank you so much for listening.